This is Dr. Amanda from StraightSmile Solutions, and today we're going to be talking about a hot topic that comes up pretty often with me when I talk to doctors, and that is Ceph Xrays. When do you take them? Do you need to take them? Why do you need to take them? And how do you know what they mean? So, this is probably one of the more advanced portions of ortho that you definitely learn in residency that you maybe won't pick up on very easily. It does help to have another orthodontist explain it to you and so you understand what it means. And to me, it's a little bit like directions or a roadmap. I know which direction to go with my treatment plan. Sometimes I totally know, and sometimes I'm on the fence and I need some guidance. And that's what a Ceph is about for me. And no, I don't take Cephs on every patient necessarily. Basically, in my mind, a Ceph, there's no reason to irradiate a patient unless there's a reason that you need to do it. So just taking a blanket Ceph. I think back in the quote unquote olden days, we would take Cephs on everyone because that was considered standard of care. But now I don't necessarily think it is. There are certainly orthodontists that do take Cephs on everyone just because that's what they do. But think about why you're doing it. If you're not going to gauge anything from it, then why subject your patient to extra radiation, right? If you're not going to look at it. So this is the way I think, and I know a lot of people think along these lines, which is, well, why are you doing it? So I definitely don't do it in adults that are class 1, where I'm mild to moderate crowding, where I'm not going to be changing their vertical position, changing their AP, changing their soft tissue position if I'm just straightening, and it's not going to really make any major changes. No need, right? But definitely on growing kiddos who I've got vertical questions or concerns, growing kiddos where there's maybe class 2 or class 3 concerns. Definitely 100%, because you need a baseline and sometimes you need to help make a right decision. Definitely on adults where they have a lot of crowding and you're trying to figure out, am I doing IPR? Am I doing extractions? Are we going to flare? I mean, you need to look and see the position of everything to decide if that's going to be stable. And I think that's one of the biggest mistakes that sometimes these direct-to-consumer companies are doing is they're just blindly moving teeth forward, right? Because they don't do IPR and they don't do extractions. So is that healthy? And is that stable? And is there bone to do that? They don't know because they don't have a Ceph. So that's just kind of my thought. So anyway, so CephX is really great. You don't need to know really anything about Cephs to use it, or at least to get the data. Now, once you get the data, someone's got to explain it to you if you don't understand what you're looking at. But if one of the easiest Ceph analyses to read, to be honest, is called the Sassoon Plus, and they do have that, and it's pretty simple to read. It basically explains it to you in like English. This is what you're seeing: small maxilla, big growing mandible, long facial height, so puts it in plain English. But anyways, I believe your first Ceph at CephX is free. So that's awesome. They have subscription plans. If you're obviously going to be doing a lot of them, then it makes sense to do that. If you want to sign up, you just click sign up and you put in your information, okay, and hit submit. And there's a bunch of FAQs here. Basically, I think it only takes like a minute or two if you just upload it, but sometimes if it's not very clear or if it's blurry, then they might have to do it manually, which takes a little bit longer, okay? There's a lot of FAQs here. Again, it's not my company, but I know everyone at the team, so I'm glad to introduce you if you have any questions. They also have like a cool, new CBCT airway module that analyzes airway. Although, I think it's good for a baseline, but you got to keep in mind airway is more of like a laying down thing, and you're taking the Ceph or the CBCT vertically, right? So it's a little bit of a different thing, and you could be swallowing. It's very dynamic, right? So, but I guess it's a good baseline thing. So at least if it's small. I can look at a Ceph and let you know if I see a small airway too. So, but I guess it's good to quantify it, I guess, or if you're doing treatment to see if it's getting better. I don't know. You can log in here, and once you log in, basically the way it's going to work is you're going to upload your Ceph, and then once they accept it, there's going to be a drop down menu on the right side. You're going to pick, there's like hundreds of different analyses. So again, if you've never done one before, if you don't really understand it, don't stress out, just pick this Sassoon Plus. It says it in plain English, and then at least you can download that into your chart and you can help to make good treatment decisions. So pricing is here. If you're interested, if you're doing it regularly, it definitely makes sense to go ahead and just get the subscription, which I think is about $60 a month. So it comes out to $20 a case, but they do all the work for you. Another common question that I get is about having a Ceph X-ray machine in your office, it probably doesn't make sense unless you're doing like a ton of them to get one. The great news is it's really easy, and most of my doctors that I worked with managed to find an oral surgeon that's nearby, or even sometimes an orthodontist that's nice, and they're willing to bill them, to take it for them. But usually oral surgeons are cool. Most metro areas will have a radiology clinic, that, or even a dental school where you can do it. I know it's like an extra step for the patient, but if they understand that why you're trying to do it, they'll want to get that data for you. So whether you're going to pay for it and reimburse, or if you're going to have them pay for it as part of the package, is really, how you do it. So, but anyways, all right. So that's pretty much it. That's CephX. I do highly recommend it. I've been working with them, my goodness, for about 3 or 4 years now. So, and everyone's been really pleased. And if you want help interpreting your Ceph, that's what I do. So don't forget to go to StraightSmileSolutions.com and schedule a complimentary consultation. In the complimentary consultation, we will not be going over any patients. We'll just be talking about your practice and tips and answering any questions. Beyond that, we can talk about how we'll help you with an actual patient, but we're glad to do that. All right. Thanks so much. We'll talk to you soon.